Mental health is a continuous struggle. It's a continuous struggle, especially for the patients, because every patient's every patient's body is different. Their medications work differently. There are people who will take certain medication and they do better with that medication. The medication, unlike medications like for diabetes, for high blood pressure, for other diagnoses, mental health medication takes a longer time. So it takes at least over 6+ weeks to take effect. And one medication that works for one person, if let's say for example, if Zoloft works for another person, another medication might work for that person in particular, but it might not work for another patients, because it depends on what chemical imbalance they have and in what junction it is. So that's why I always, when we have patients who have mental health, I always refer them to a psychiatrist, because psychiatrists have been trained to be patient, to learn, to know which medication to give, and they keep monitoring these patients, and eventually they pick the medication that works for them with the therapy and depending on what somebody is struggling with. So I think the mental health is very challenging, and we need to empathize with the patients, and we need to direct them to the right people within doing therapy and taking the medication or their drugs, and also, you know, working with themselves. That can help. And also, even in the mental health, it depends on what some people have. You know, they are more sick or have more symptoms than others. So it all depends on different things. So when we talk about mental health, this is a big elephant that it has to be, you know, a patient has to be helped, from the patient to the families, to the doctors, to the psychiatrists, to the regular doctors, to the psychologists. So all of these people have to work together towards the same goal, helping that patient. And when that patient finds what works for them, I know they are the happiest people. So that is my take for mental health. We need to work, we need to help them. The patient has to be the center. So everybody is working towards helping that patient. And I like when patients coordinate between the different doctors. If you're seeing a psychiatrist, you're going to see your regular doctor, please tell your regular doctor, I see this psychiatrist, these are the medications I'm taking. Sometimes when the psychiatrist is not able to give or prescribe those medications, your regular doctor might give you just a few medications to help you until you get that appointment, because sometimes psychiatrists are so busy they don't have appointments like 3 months ahead of time. So that is why it has to be coordinated between a psychiatrist, a psychologist, and their regular doctor, and the therapist. All these multidisciplinary personnel have to work together.